So just tell me a little bit about what brought you to the practice initially.
I initially came here because I've been having some health concerns that I didn't really understand for years. I mean, I told Dr. Crosser when I first came in, I remember going to my primary care physician and saying, I don't know why I'm tired all the time. I have had migraine headaches since puberty. And yet I live a pretty healthy lifestyle. I eat healthy foods, I run a lot, I do cross training. Like I feel like I should have more energy.
Yeah.
And also maybe not the headaches and these unexplained reactions to food, like my bloating in my stomach and things like that. But most doctors have kind of waved me off, and I remember that particular primary care doctor saying, well, Rebecca, your body is 34 years old. I thought, that seems pretty young. I'm running marathons, like I'm not, but there are days where I feel horrible. And I tried giving up gluten for a little while. I had tried giving up dairy, which I have done pretty consistently, but I really needed, I gave up on a lot of that because I wasn't consistently feeling good anyway, and I needed somebody to guide me through the process of not necessarily just eliminating foods, but run tests, talk things over with me, things like that. So.
Yeah. And how has coming here, like how long have you been a patient?
5 months, I think. Yeah.
So in the last 5 months of being a patient, how has that impacted those things?
Well, one huge thing is that I was able to get off of a headache medicine that I took prophylactically, but it's a very strong medicine, and it had implications for memory and things like that. But in the past, when I tried to wean myself off of it, my headaches returned, and my headaches have been much better and much less frequent. So that was a big one. And then there were some mechanical things that were going on with my body that I didn't even lead with because they were pretty far down the list of things. I had gone to lots of specialists about why the left side of my body would lock up in pain when I was running, and they put me through all these PT programs, and none of that helped. I mean, I would be doing 45 minutes a day of these very specific PT exercises, and nothing helped. I went to the Rothman Institute, and after a couple of adjustments, which were just incidental, just because Dr. Crosser happens to do that too, I have been running with so much less pain, and that's pretty amazing. A pretty amazing side effect. As far as the stomach things, they're better. I don't think that we've figured out everything yet, but I haven't gotten through my sort of testing phase, and we're going to run some tests, or Dr. Crosser's going to suggest some tests that she wants to run again. But I've felt much better, and it's also just comforting to have someone who is an expert talk through all of it with you and talk about why, that this is normal if you are eating the wrong things or wrong things for your body. So it's been a really interesting and productive journey.
What has made coming here different than the other places?
I think a willingness to just talk about it and look past, I look past some of the obvious things it could be. I mean, I for a long time, for several years, had the impression that all of my symptoms, both food reactions and fatigue and everything, were related to allergies, because they just seemed to come and go. And I think it was a different primary care doctor who suggested that in the first place. And so I just thought, okay, well, it's that. But there was I got all of my allergies. I got full allergy tests, and I'm not really allergic to anything, maybe some seasonal allergies. So that didn't seem to be the culprit either. And Dr. Crosser will, talks through all of the possibilities, and she just knows so much more about what could be going on than any of the doctors that I've seen. So
if somebody was on the fence about coming here, why would you recommend her to them?
Well, I think she has a lot of ideas that you won't have heard, and suggestions that you won't have heard. So I think, that it was really kind of a revelation to me to find out all the things that, you know, there are so many things going on and how all the systems affect each other, and that I you know, I don't think most doctors learn that. I mean, they definitely don't, unless they go to a special program, and most of them do not. So it's been, I highly recommend going through this process with someone who is more informed.
Yeah, I think I've heard a lot of people talk about that as well. Just kind of just feeling like she's been able to dig or like look in places where maybe modern medicine wouldn't.
Or where you would just be given a prescription for something. And I mean, I'm certainly not anti-prescription if it's for the right thing, but in my life of taking medicine for migraines, I know I've been given a lot of migraine medicine that is not targeting the cause of my migraines.
Mm-hmm.
And, you know, those things really wreak havoc on your system.
Yeah. So. That's great. Well, thank you so much.
You're welcome.
I really appreciate it.